everyone. Thank you for joining us today for our first Five in Focus interview. My name is Angela Spinelli.
And I'm Andrea Uribe, and we are the first 5 SLO County interns. And today we will be speaking with Dr. Doug Major, who is the professional coordinator for the SLOLionsEye.org, to talk about youth vision screenings.
So Dr. Major, we first want to just talk about the longevity of your program with First Five. It's one of the longest funded First Five programs. And so we would love if you could just tell us a little bit about how you've seen this program really transform and evolve over the years.
Well, believe it or not, we were even pre-First Five when they call it Prop 10 back in those days. And see, San Luis was always an earlier adapter to this. So we actually used to do pro bono exams to preschools and Head Starts way in, since the 1980s. But it wasn't sustainable. And so we were really excited when First Five was first introduced to be able to make this more stable and countywide for this outreach. And so after all the initial assessments, we were just proud to be the first ones to use First Five funds to see children. And we did it like the first day of January or second day of January, we saw kids that day. So we're very excited that we were able to do the outreach very early on now, over 20 years.
And why is it so important for young children to be screened?
Well, a couple of reasons. We have a sister program that started in the 1960s that sees all the children in elementary schools. And we used to see them in first grade. And by first grade, you would see kids that had, for example, a lazy eye. And an old school of thought was that there was a critical period and that would slam shut. And so if you caught it by first grade, there was nothing you can do. So earlier intervention, particularly with lazy eye, is key. And we did a few little studies that showed that the First Five program identified those children very early and was extremely effective. And this is something that's hard with pediatricians to do because a lot of times the kids are squirming and things. But with our technique, it's actually a mini eye exam on site. So that's why it works so well.
Okay. And what would you say are the most vital ages to perform vision screening?
Well, this is sort of a unique change in the demographics of the state of California. The state of California is a lot more Latinx kids now. It's up to 50% of the kids. And they have a specific type of condition called farsighted with astigmatism. What that does, and they have that before they enter preschool. And that makes vertical and horizontal lines not focus well, right at that key time when they're learning to read. So a lot of people have glasses for nearsightedness, for example, and they could just sit closer to the board. But these are children that are put at a disadvantage the moment they enter school and start looking at text. And because it's been shown in California through a USC study that number is going to like double or triple, earlier intervention for this particular type of condition, for this particular type of group, is essential to make sure that they're, reading ready and academic successfully.
Dr. Doug, how has your practice shifted because of the COVID-19 pandemic to still serve children and families?
Well, that's the sad thing is that, our access to doing screenings on site have almost gone to nothing. And this is just, good public health policy as well as other things. We still see, obviously, children in our office, and we encourage children to come and get their eyes checked. Fortunately, in our case, since we have such a high reach, in other words, these are conditions that if we catch them, we catch at age 3, they've already been caught. So there's a year that's going to be a lag year. But since our county does such a good job of seeing every single child and then recatching them in kindergarten, recatching them in first grade, we're disappointed that we can't go and do what we love to do. But we're biding our time and actually doing some outreach through the state to have better access to care through a change in policy. So that a lot of effort's been placed because there's been a change of policy in our county where glasses are not as accessible because of a policy change to make all the children's glasses in the prison system. So that time we were spending doing that, we're now being just child advocates at Sacramento.
Mm-hmm. So pre-pandemic, then you did these screenings normally in the schools rather than at your site?
Yeah. So the neat thing about this whole pre-screening is that when children get very apprehensive a lot of times in a doctor's office. But if you can go into a preschool and make it fun, make it accessible, and then you always get the bravest kids to do it first, because if there's tears, you've lost. So you have that bravest child come in, show them some cool things, and then they get excited, and then everybody wants to do it. And so we are pretty successful. More successful would be in a private office. Remember, this is just an exam to check for glasses, and but we can do it very efficiently as professionals and very accurately versus machines that can also do some of it. But because we can do it so well, we generally don't have a lot of problems with kids, because they get so excited about doing it, because it's on site and great support and fun. Thank you.
What overall would you say is your favorite part of doing these youth screenings?
Well, there's just so many cases where, it just change of life, right? Early on, we've had kids that, for example, are quite farsighted, and so they just see everything as a globe, and they've been labeled autistic and other things. And they put the glasses on, and they suddenly see better. To see children that sometimes generational with family to family, that we can break that terrible cycle of not being successful in school. I have a weird situation where I also go to the county jail. So believe it or not, I've been here long enough. The first thing I asked for the guys in the county jail, where did you go to school? Because I probably saw them in school, and then I can encourage them. And believe it or not, there's certain types of prescriptions that tend to lend yourself more to being unsuccessful in society. And to be able to give children the tools early to be successful in society is truly gratifying. Just one example, I had one girl that first put on her glasses and she'd never seen before, and she looked up and there was a big lion poster, and she looked up and said, "Simba," like that. So, but we have those wonderful stories of changing lives, and some are not as dramatic, but see, little by little, it all adds up. So we have fun doing it. This is probably more than the kids.
Great. Well, thank you. Is there anything else that we didn't cover that you would like to share?
Yeah, I'd just like to thank First Five of San Luis Obispo. I think, as I've observed the state, we have one of the best use of funds and the most best staff to try to get the real services to real children for people and kids under age 5.